I'm a doctor of pharmacy and a licensed pharmacist, and here's what I have in my medicine cabinet.
This is part one.
Part one's gonna be cough and cold edition, but when I have a cough, I go for a cough suppressant. So Delsum, dextromethorphan, Robitussin. This is what I recommend. It works really well. I'm actually a poor CYP2D6 metabolizer, so I take a half a dose, or else it lasts too long and it makes me kind of nauseous and gives me the shits. For a stuffier runny nose, I go for Afrin, usually first line. It's oxymetazoline, it's twice a day, lasts like 12 hours, or pseudoephedrine. You can take it every 4 to 6 hours, unless it's a 12-hour version. This is kind of activating, so it can increase your blood pressure and increase anxiety. For sore throat, I take ibuprofen. This also helps with muscle aches and pains. I also take chloroseptic, which is actually benzocaine. It's a local anesthetic. These are little cough drops. Phenol is what I use at night, so I don't like choke and die. Phenol spray or chloroseptic spray works really well. For a headache, I take Tylenol. The max dose is 1 gram or 2 of the 500 capsules 4 times a day, every 6 hours. I didn't say, but for fever, you can take both together. There's no interaction there. I usually just do that anyway when I'm down bad. Ibuprofen I kind of like better though for fevers. When I got the shits, boom, Imodium or loperamide. Loperamide is a perfectly acting synthetic opioid, so it doesn't really get into the brain at normal doses. It's in the same drug class as fentanyl. This is fentanyl, this is loperamide. They're both phenylpiperidine derivatives. Of course, I got Pedialyte in my box. It has sodium, potassium, and chloride in it. It actually has a little bit more potassium than like Gatorade. If you're having a lot of diarrhea, it might be good to grab this because we're usually worried about potassium loss with excessive diarrhea or excessive vomiting. But I also like Gatorade because it tastes better. The blue one or the purple one. I don't really take a lot of combo products because I usually take medications by my symptoms, but if I were to take a combo product, this is it. The day version, we have Tylenol or acetaminophen, we have dextromethorphan, which is Delsum as I showed you earlier, and then we have pseudoephedrine, which is the nasal decongestant. This is basically Dayquil, but with pseudoephedrine instead of phenylephrine, a more potent nasal decongestant. In the nighttime, we have Tylenol again, we also have Delsum, and we also have pseudoephedrine, but we also have chlorpheniramine. Chlorpheniramine is a first generation antihistamine. This is basically NyQuil, but with pseudoephedrine instead of phenylephrine. It also has chlorpheniramine instead of doxylamine. Both of those are first generation antihistamines. I don't know if you've ever heard of chlorpheniramine, but it's in Tussinex, which is a prescription drug, chlorpheniramine and hydrocodone, C2. It's for cough.